Question 11. If nurse administers an injection to a patient who refuses that injection, she has committed A. Assault and battery. B. Negligence. C. Malpractice. D. None of the above. Correct answer, A. Assault and battery. Assault is the unjustifiable attempt or threat to touch or injure another person. Battery is the unlawful touching of another person or the carrying out of threatened physical harm. Thus, any act that a nurse performs on the patient against his will is considered assault and battery. Question 12. If patient asks the nurse her opinion about a particular physician and the nurse replies that the physician is incompetent, the nurse could be held liable for A. Slander. B. Libel. C. Assault. D. Respondent superior. Correct answer, A. Slander. Oral communication that injures an individual's reputation is considered slander. Written communication that does the same is considered libel. Question 13. A registered nurse reaches to answer the telephone on a busy pediatric unit, momentarily turning away from a 3-month-old infant she has been weighing. The infant falls off the scale, suffering a skull fracture. The nurse could be charged with A. Defamation. B. Assault. C. Battery. D. Malpractice. Correct answer, D. Malpractice. Malpractice is defined as injurious or unprofessional actions that harm another. It involves professional misconduct, such as omission or commission of an act that a reasonable and prudent nurse would or would not do. In this example, the standard of care was breached. A 3-month-old infant should never be left unattended on a scale. Question 14. Which of the following is an example of nursing malpractice? A. The nurse administers penicillin to a patient with a documented history of allergy to the drug. The patient experiences an allergic reaction and has cerebral damage resulting from anoxia. B. The nurse applies a hot water bottle or a heating pad to the abdomen of a patient with abdominal cramping. C. The nurse assists a patient out of bed with the bed locked in position. The patient slips and fractures his right humerus. D. The nurse administers the wrong medication to a patient and the patient vomits. This information is documented and reported to the physician and the nursing supervisor. Correct answer, A. The nurse administers penicillin to a patient with a documented history of allergy to the drug. The patient experiences an allergic reaction and has cerebral damage resulting from anoxia. The 3 elements necessary to establish a nursing malpractice are nursing error, administering penicillin to a patient with a documented allergy to the drug, injury, cerebral damage, and proximal cause. Administering the penicillin caused the cerebral damage. Applying a hot water bottle or heating pad to a patient without a physician's order does not include the 3 required components. Assisting a patient out of bed with the bed locked in position is the correct nursing practice, therefore, the fracture was not the result of malpractice. Administering an incorrect medication is a nursing error, however, if such action resulted in a serious illness or chronic problem, the nurse could be sued for malpractice. Question 15. Which of the following signs and symptoms would the nurse expect to find when assessing an Asian patient for postoperative pain following abdominal surgery? A. Decreased blood pressure and heart rate and shallow respirations. B. Quiet crying. C. Immobility, diaphoresis, and avoidance of deep breathing or coughing. D. Changing position every 2 hours. Correct answer, C. Immobility, diaphoresis, and avoidance of deep breathing or coughing. An Asian patient is likely to hide his pain. Consequently, the nurse must observe for objective signs. In an abdominal surgery patient, these might include immobility, diaphoresis, and avoidance of deep breathing or coughing, as well as increased heart rate, shallow respirations, stemming from pain upon moving the diaphragm and respiratory muscles, and guarding or rigidity of the abdominal wall. Such a patient is unlikely to display emotion, such as crying. Question 16. A patient is admitted to the hospital with complaints of nausea, vomiting, diarrhea, and severe abdominal pain. Which of the following would immediately alert the nurse that the patient has bleeding from the GI tract? A. Complete blood count. B. Guaiac test. C. Vital signs. C. Abdominal girth. Correct answer, B. Guaiac test. To assess for GI tract bleeding when frank blood is absent, the nurse has two options. She can test for occult blood in vomitus, if present, or in stool, through Guaiac hemoccult test. A complete blood count does not provide immediate results and does not always immediately reflect blood loss. Changes in vital signs may be caused by factors other than blood loss. Abdominal girth is unrelated to blood loss. Question 17. The correct sequence for assessing the abdomen is A. Tympanic percussion, measurement of abdominal girth, and inspection. B. Assessment for distension, tenderness, and discoloration around the umbilicus. C. Percussions, palpation, and auscultation. D. Auscultation, percussion, and palpation. Correct answer, D. Auscultation, percussion, and palpation. Because percussion and palpation can affect bowel motility and thus bowel sounds, they should follow auscultation in abdominal assessment. Tympanic percussion, measurement of abdominal girth, and inspection are methods of assessing the abdomen. Assessing for distension, tenderness and discoloration around the umbilicus can indicate various bowel-related conditions, such as cholecystitis, appendicitis and peritonitis. Question 18. High-pitched gurgles head over the right lower quadrant are A. A sign of increased bowel motility. B. A sign of decreased bowel motility. C. Normal bowel sounds. D. A sign of abdominal cramping. Correct answer, C. Normal bowel sounds. Hyperactive sounds indicate increased bowel motility, 2 or 3 sounds per minute indicate decreased bowel motility. Abdominal cramping with hyperactive, high-pitched tinkling bowel sounds can indicate a bowel obstruction. Question 19. A patient about to undergo abdominal inspection is best placed in which of the following positions? A. Prone. B. Trendelenburg. C. Supine. D. Side lying. Correct answer, C. Supine. The supine position, also called the dorsal position, in which the patient lies on his back with his face upward, allows for easy access to the abdomen. In the prone position, the patient lies on his abdomen with his face turned to the side. In the Trendelenburg position, the head of the bed is tilted downward to 30 to 40 degrees so that the upper body is lower than the legs. In the lateral position, the patient lies on his side. Question 20. For a rectal examination, the patient can be directed to assume which of the following positions? A. Genupectoral. B. Sims. C. Horizontal recumbent. D. All of the above. Correct answer, D. All of the above. All of these positions are appropriate for a rectal examination. In the genupectoral, knee-chest, position, the patient kneels and rests his chest on the table, forming a 90-degree angle between the torso and upper legs. In Sims position, the patient lies on his left side with the left arm behind the body and his right leg flexed. In the horizontal recumbent position, the patient lies on his back with legs extended and hips rotated outward.